brother.
Okay, so we're gonna learn about the murmurs. Look, I'm not gonna go 15 minutes talking to you about murmurs, but I'm gonna show you a way to memorize the murmurs for the medicine exam because the doctor mentioned she'll bring at least one question from it. And what I'm going to do is I'm gonna show you the mechanism of why all these murmurs occur, and you don't have to memorize these conditions in the green. Well, the exception of these two, but you will know most of them by logic. So I'm just gonna give you a quick help on how to know them, okay? So let's start with the murmurs. So what is a murmur? A murmur is an extra heartbeat sound. But before we get into that, let's give you just a quick cardiac physiology, okay? So normally there's two normal heart sounds, S1 and S2, L, D. And S1, when is it produced? It is produced, as we can see in the heart drawing right here, when the tricuspid valve and the mitral valve, when they are closed. And typically what happens next is that you see these right ventricles, they will contract. There will be a systole. So that's why when they're contracting, they're going to be pumping blood. And when they pump blood, look, what are these two valves in front of it is going to be pumping against? It's going to be pumping against the pulmonary valve and the aortic valve. And normally during systolic phase, they should be opened. So they're going to be contracting and they will send all this blood until these two valves will close. When the aortic and the pulmonary valves, they are closed, this will produce the second heart sound, S2. So S1 from the tricuspid mitral valve closure, the S2 is from the pulmonary and aortic valve closure. And in between S1 and S2, ايش حصل للventricle contraction عشان يسموها systolic phase. Between S1 and S2, afterwards the right inlet ventricle will relax, hence the diastolic phase, and then what happens? These valves, tricuspid mitral valve, will open again, will pump blood, and they will go back to producing their beautiful S1 phase. Okay? Why is this important? Because normally we have only two normal heart sounds, S1 and S2. Now here comes the case where we are hearing extra heart sound. The extra heart sound is an abnormal heart sound, so murmur. Now in a case of murmur for the exam, we divide it into three things, and we divide them based in which phase do they appear. Do they appear when the ventricles are contracting, or do they appear when the ventricle is relaxing, or do they appear in the systolic and they are there continuous? They are there regardless, they are there 24/7. نسميها continuous, okay? So systolic murmur, diastolic murmur, continuous murmur, meaning which phase of the heart and the ventricle do they appear in remaining, okay? So now we got that out of the way, let's subdivide them one by one, shall we? So in the systolic murmur, we will subdivide them. When exactly do they occur? When does this murmur sound, when does it occur during systolic? Does it occur in the beginning, when the ventricles are ejecting large amounts of blood, نسميها ejection systolic? Or is it in the middle of systolic? ولا هي بتبدأ في الbeginning and تستمر for the entirety of systole. You have a murmur at the beginning of systole and it will remain this murmur for the beginning. It's the ejection systole. Ejection systole, it will appear in the beginning and then it will stop. For the remaining systole, you're not here, only in the beginning. هنشوف. نبدأ بالejection systole. In ejection systole, when we hear something called ejection systolic murmur, what do we mean? It means there's a murmur as soon as these right and left ventricle, they are contracting the blood. So what could be the possible conditions? There could be only three conditions. In that case, it could be maybe the aortic pulmonary valves. Normally, what should be these valves? These valves should be open or closed in systole. They should be open. So let's say they open, but they don't open completely. And they have a condition known as stenosis. So they don't open completely. And you're injecting large amounts of blood. What happens? More blood will go through this narrow opening and will produce this murmur. So what do we call that condition? Aortic stenosis or pulmonary stenosis, okay? And here's the thing, as an extra thing, typically since we have a narrow opening of these two valves, when they close, they'll have a quiet S2. Remember what S2 was, closure of these valves. But if there's a narrow opening, then you'll have a smaller closure. You'll have a small vibration being produced. So it could be aortic or pulmonary stenosis, or it could be aortic sclerosis. Sclerosis is hardening of the aortic valve, or hardening of the aorta نفسها. But this time you'll have a normal S2 because the valve is normal. Aortic sclerosis هو الأورطة المتأثرة مش الvalve. Okay? So those could be the three reasons why there's a murmur when these right and left ventricles are being ejected at the beginning, very beginning. So let's say mid-systolic. Let's say this murmur is produced in the middle of ventricular contraction. What could be the possible cause? Well, the only possible cause is flow murmur. يعني إيش؟ يعني the valves are normal, the aorta and pulmonary artery are normal. The murmur is produced when the blood is flowing from these ventricles towards the respective arteries, or the respective arteries. تمام? So basically, flow murmur means a murmur is produced when the ventricular blood flow passes through these valves. It's normal, it's physiological. Okay, you have to know. Okay, mid-systolic. Remember. Now, what about pan-systolic? Now, in the case of pan-systolic, this means we have a murmur that occurs as soon as the right and left ventricular contract, and يستمر. It will يستمر for the entirety of ventricular systole. مش زي ejection systole in the beginning, but pan-systolic start all the way. What could be the possible reason? The possible reason could be this. It could be a case of something called ventricular septal defect. Imagine the right and left ventricle, when they pump all this huge amount of blood, they might pump it through this narrow opening. What is this? This is the ventricular septum. If there is a ventricular septal defect, like a patent foramen valve, it can pump blood through this narrow opening continuously for the remaining of systole and cause pan-systolic murmur. So one of the causes of pan-systolic murmur is may have had additional ventral septal defect. Okay? That ventral septal defect may be two conditions. Now, in these two conditions, let's ask ourselves again. Normally, when the ventricles are contracting, the pulmonary and aortic valve should be open. To what valves should be closed in the meantime? These two, the mitral and tricuspid valve, right? But let's say they did not close properly, and now all this huge amount of blood, they're going back, the regurgitation. So in that case, for the entirety of systole, as they're contracting, the blood will go this way, and the blood will go up. So we call that condition what? Mitral regurgitation, tricuspid regurgitation. Mitral tricuspid regurgitation. That's the only way you can possibly hear a pan-systolic murmur for the entirety of systole. Okay? So think of pan-systole as holes. There's a hole here, there's a hole there, there's a hole here. Okay? It's remaining throughout. Ejection systole, there's a hole here, or a problem with the aorta. Okay? Mid-systolic, just flow murmur, blood flow. خلصنا السystolic. And then شلت diastolic. Now, in the case of diastolic murmur, we said this is a murmur produced when the ventricles are this time relaxing. This part right here, okay? Now, we divide the diastolic just like the systolic. We divide it based on when does it occur. Do they occur in the beginning of ventricular relaxation or in the middle of ventricular relaxation? And now we want to figure out, okay, what conditions could be causing a murmur to be produced in the beginning or in the middle of diastole? So in the case of early diastole, how could we hear a murmur as the ventricles are relaxing? There could be only two possible conditions. Normally, like I said, when these ventricles are relaxing, normally what should be closed when they're relaxing? These two bad boys right there. And the tricuspid and mitral valve as well. But let's say the aorta and the pulmonary valve, they are closed but not completely. There is a leakage. Now all this blood they're pumping in front of, now they're coming back. They're coming back. As soon as it relaxes, then in that case we call this what? Aortic regurgitation, pulmonary regurgitation. Okay? So the only way you could, when you think of early diastolic murmur, think of it. The aorta and pulmonary valve, they are not closed completely. The ventricles, as soon as it relaxes, the blood that it was contracting previously, it comes back. Tamam? Now, that's early diastole. Now let's look at mid-diastole. In mid-diastole, typically, like we said, the aorta and pulmonary valve, when the ventricles are relaxed, they should be closed, right? Also, the tricuspid and mitral valve, they will be closed as well. But after a few milliseconds later, they will open. Tamam? They will open. But let's say they open, tamam, after a few milliseconds of ventricular relaxation, they open, but not completely. There's so many conditions, when the valve does not open completely and there's a narrow opening, there's a tricuspid stenosis or mitral stenosis. So in case of mid-diastolic murmur, tricuspid or mitral stenosis. So think of it. Ventricle, when they relax. Early diastolic, think of aorta pulmonary. Okay, after a few milliseconds later, okay, there's no murmur at the beginning of relaxation, but after a few seconds of ventricular relaxation, there's a murmur. Think of these two. Okay, so these two should close, and these two should close. But these will be closed during relaxation, and these should be open afterwards normally. But if they open, they're narrow, they're conditioned. Okay? So that's diastolic murmur. آخر شيء continuous murmur. As for the continuous murmur, we said this is a murmur that is produced during ventricular contraction. ويستمر. It would last throughout the entire systolic phase and diastolic, throughout the entire heartbeat, 24/7. Okay? Now we subdivide this based on the feeling. What does it sound like? What does it sound like? We base this on what does it sound like, not during time, because it lasts throughout the entire time. So continuous murmur, The sound, it could be machinery-like a machine, like a train going through a track, or it could be blowing sound, essentially. So you have to memorize this. For the continuous machinery murmur, it could be a case of على patent ductus arterius. This one, these two you have to memorize like your own name, but the other two you can understand by logic. So machinery, continuous machinery murmur was patent ductus arteriosus. If you don't remember patent ductus arteriosus, this is an anomaly that basically creates a pathway. Yeah? So this is the aorta, this is the pulmonary artery, and there's a patent pathway between the aorta and pulmonary. So when the ventricle, they're contracting their blood, they will go to the aorta, and then some of this blood will go to the pulmonary artery as well. So it will produce a machinery-like murmur. If you want to remember, think of it. Machinery, patent ductus arteriosus, there's a track. There's a track, like a train track in between. Now the last one is blowing, continuous blowing murmur. For continuous blowing murmur, there's only two conditions: venous hump and mammary shuffle. Venous hump, venous hump, when the internal jugular vein, when they're pumping blood, they're going to pump blood to where? To the brachiocephalic vein. If you don't remember brachiocephalic vein, these are the two veins that join together to form the superior vena cava. So when the internal jugular vein, when they're flowing this flow of blood, when it goes from the IGF to the brachiocephalic vein, it might produce a small vibration, a small murmur. It's physiological. And similarly, venous hump. Okay? And mammary shuffle, this is a vibration that's produced above the breast. In some women, they might have arteries supplying the breast from above, and they might hear a little bit of a vibration sound. But when they compress their breast, the murmur disappears. So in that case, we'll call that mammary shuffle, where there's a continuous blowing murmur. Venous hump, mammary shuffle. Think of it, blowing murmur has nothing to do with the heart. I mean, it has to do with something peripheral. Okay? Well, machinery, think of one anomaly. Patent ductus arteriosus, train tracks in between these two. And that's pretty much it. That's all of it. And I hope that you at least get an idea, rather than just memorizing like an idiot. I mean, I'm an idiot as well, but still. Okay? That's it.
Yes.